Routes of drug administration. In this video, we study the routes of drug administration. The drug is administered inside the body or introduced inside the body through the various routes. So we will see all the possible routes one by one. First of all, we have intral routes of drug administration, which involve the GIT. That means the drug must go into the GIT and possess first pass effect. The intral routes include three routes. First and the most common is oral route, and I am displaying the pictures for better understanding. So, the first is oral route. In the oral route, we give the drugs by mouth. Second is rectal route. We give the drugs by rectum. The third is sublingual route. In the sublingual route, we place the drug under the tongue. The second is parenteral routes of drug administration, which do not involve the GIT. That means the drug do not go into the GIT and do not possess any first pass effect. So, the parenteral routes include 12 different routes, which we will see one by one. First of all is intravenous route, in which we inject the drug in veins. Second is intramuscular route, in which we inject the drug in muscles. The third is subcutaneous route, in which we administer the drug through subcutaneous membrane. The fourth is topical route, in which we apply the drug on skin or mucous membrane. The fifth is transdermal route. The transdermal route include the transdermal patches we put on skin. The sixth is inhalation route, in which we administer the drug through inhalation, like in case of aerosols. The seventh is intraperitoneal route, in which we inject the drug into peritoneum. The eighth is intracardial route, in which we put the drug into heart muscles and ventricle. The ninth is intraarterial route, in which we inject the drug by arteries. The 10th is intrathecal route, in which we put the drug into CSF. This route is mostly used for the drugs that does not cross the blood-brain barrier. The 11th is intra-articular route, in which we inject the drug within joint space. And the 12th and the last is bone marrow injections, in which we put the drug in bone marrow.